I'd like to share a Facebook post with you from October. Around 1985, I was working the night shift at Cars Huffman. I just bought my first condo and was definitely living paycheck to paycheck. I remember driving by a strip mall on Huffman, and I saw a business sign for a small pizza restaurant. When I went inside, I was greeted by a man with jeans, a t-shirt, a flower-covered apron, and a big smile. That man was Pete Peterson. After a brief conversation, I learned that Pete was the owner, dishwasher, cook, and delivery agent too. I knew I couldn't afford to support Pete's business too often, but I remember thinking, here's a man struggling to build a business and he needs community support. Fast forward to today. That very same man who needed our support for his business is consciously crushing the hopes and dreams of today's restaurant owners who are just asking for the same opportunity that he asked for. These businesses just want the chance to proudly serve their customers and provide for their families. Sadly, this administration and assembly wants us to fear the numbers, fear whatever metrics works for them, and fear the virus. After more than 9 months, it's safe to say that we can respect the numbers, respect the metrics, respect the virus, and safely open Anchorage back up. If given the choice, this administration and assembly have no problem hanging that flower-covered apron on a hook in the back room of an empty restaurant. So I have lived in Anchorage since 1966. So 2 years after the earthquake, Anchorage became my home. I have extremely fond memories of growing up in the city. One of them is standing shoulder to shoulder with the rest of my frozen friends on 4th Avenue watching the finish of the Fur Rendezvous sled dog races. And it was incredible to share the celebration of that event with those people. These are the same people that built back the city after the most devastating event in our state and city history. This assembly, this administration, you guys are our '64 earthquake. The destruction may not be as visible, but the devastation is equally palpable. But you need to know that just as that young boy 50 years ago watched those sled dogs cross that finish line, Anchorage will recover, Anchorage will be strong again, and Anchorage will cross that finish line together in spite of you.
I'm licensed to practice medicine in the state of Alaska as a physician assistant. My wife and I came to Alaska in 1989 as traveling nurses after 10 years on the road working in 31 hospitals in 14 states. My wife has worked as an RN in every emergency room in Anchorage. On March 30th, the models predicted we would have 7,800 hospitalizations with 5,800 deaths within 3 months in Anchorage and Mat-Su. According to the model, 75% of those hospitalized with COVID were going to die. The reality is that in 8 months since that model prediction, Anchorage has had 576 hospitalizations with 82 deaths. The current narrative is about not overwhelming the healthcare system. Long before COVID, ICU beds were full, critical patients were held in the ER, and eventually administration would put the ER temporarily on divert. Being a business, hospitals hate going on divert. We are told the Muni has emergency capacity overflow preparedness, and that's a great plan. As far as medical staffing capacity is concerned, giving bonuses to attract traveling nurses is common practice. If hospitals offered a $50,000 bonus at the end of a 13-week assignment, they would have all the critical care ER nurses they require. Unfortunately, the same hospitals forced to lay off employees earlier this year due to restrictions on medical procedures also suffered abnormally low occupancy rates throughout the year. They likely are unable to pay that attractive bonus. For comparison, CARES money spent on trails, $4.5 million, would cover the bonus for 90 nurses. The $22 million vagrant housing shell game would have supplied 440 nurses. I always discuss with my patients risk versus benefit regarding medical decisions. Let's apply that to the shutdown mandate. Do nothing, and the numbers of positives may increase. Shut down, and you may delay the spread of positive cases temporarily, but what's the risk of the shutdown? Increased unemployment and business closures. Our children's education degraded even further below the present fourth worst in the nation. Increased unreported domestic violence and child abuse, increased substance abuse, suicidality, and mental health crisis intervention. In closing, the acting mayor and the assembly should stop trying to be helicopter parents for everybody in Anchorage and focus on funding healthcare capacity rather than projects that have nothing to do with COVID-19. Don't destroy our economy and community with paternalistic, one-size-fits-all mandates. The CDC statistics on COVID-19 mortality are not ambiguous. Give us the facts, give us your recommendations, then realize we are adults and the vast majority of us know how to make informed decisions based on our personal and family risk analysis. The risk of your plan far outweighs the benefits.